Can trauma truly lead to addiction, or is it just a myth? This question reverberates through the corridors of our minds when we try to comprehend the relationship between trauma and addiction. For some, this connection might seem like a mere conjecture, a myth spun out of thin air. But let's not jump to conclusions just yet. In the realm of psychology, this connection isn't a matter of hearsay or speculation. The relationship between trauma and addiction is far more intricate than what meets the eye. There are countless psychological studies that back up this connection, painting a picture that's both fascinating and challenging to comprehend. We're not talking about an arbitrary link, but a deeply woven fabric of cause and effect, where trauma can indeed act as a catalyst for addiction. It's a complex tapestry that intertwines the human psyche, emotions, and behaviors. As we delve deeper, we'll unravel the complex relationship between trauma and addiction. What do the experts have to say about this connection? Renowned psychologists and therapists have long studied the relationship between trauma and addiction. Their research paints a compelling picture of how trauma can create a susceptibility to addiction. Dr. Gabor Mate, a respected figure in the field, suggests that trauma changes our brain's wiring, making us more prone to addictive behaviors. He talks about how adverse experiences can disrupt the balance in our brains, altering the way we respond to stress and pleasure. Drawing from decades of research, Dr. Bessel van der Kolk echoes this sentiment. He explains that trauma can leave a person feeling disconnected and isolated. This emotional pain can lead to a search for relief, often in the form of substances or behaviors that offer temporary solace but may foster addiction. Dr. Judith Herman, another leading expert, emphasizes the role of trauma in shaping our coping mechanisms. She argues that when traumatic events overwhelm our ability to cope, we may turn to addictive behaviors as a means of self-medication, a way to numb the pain and regain control. Meanwhile, Dr. Peter Levine points out that trauma can leave us stuck in a state of high alert, leading to chronic stress that can wear us down physically and emotionally. This state of constant tension can make addictive substances seem appealing as a way to escape. The experts have spoken and the evidence is clear. Trauma can be a powerful precursor to addiction. But how exactly does trauma lead to addiction? Let's take a closer look at the psychological mechanisms that form this complex web. Traumatic experiences often result in emotional pain, a burden that's not easily shaken off. This pain can feel overwhelming, like a storm raging inside one's mind, and it's human nature to seek shelter from such a storm. Now imagine substances as a form of shelter, an umbrella, if you will. They seem to offer immediate relief, a temporary reprieve from the emotional tempest. But here's the catch. This umbrella is full of holes. It's not a solution, but a dangerous illusion. Substance use can temporarily numb the pain, but it doesn't heal the wounds inflicted by trauma. Instead, it often deepens them, creating a vicious cycle where the substance use becomes a necessity to cope with the ever-increasing emotional turmoil. Trauma can create a storm of emotions, and for some, addiction is a misguided shelter. So, what have we learned about the relationship between trauma and addiction? It's quite clear that the two are intricately linked, woven together by a complex tapestry of psychological, physical, and environmental threads. Trauma, whether it's a single event or a series of ongoing experiences, can leave deep psychological scars. These scars, in turn, can lead to a desperate search for relief, a search that too often culminates in the dark and destructive world of addiction. The experiences of trauma can range from emotional neglect to physical abuse and everything in between. No matter the source, the impact is profound, often altering the course of an individual's life and setting them on a path towards addiction. This is not to say that every person who experiences trauma will develop an addiction, but it does underscore the fact that trauma significantly increases the risk. But here's where hope enters the picture. With a deeper understanding of the connection between trauma and addiction, we can develop more effective trauma-informed approaches to addiction treatment. This means not just treating the symptoms of addiction, but addressing the underlying trauma that fuels it. It means creating safe, supportive environments where individuals can begin to heal both their psychological wounds and their physical dependencies. In the end, it's about more than just understanding the theory. It's about using this knowledge to pave the way for better, more compassionate treatment. Understanding the link between trauma and addiction isn't just about theory, it's about paving the way for more effective, compassionate treatment.